Tinderbox podcast, where we amplify marginalized voices and we ignite actionable change to build healthier communities. I'm your host, Mishka Russell, and in our mission to fight health inequities, we often talk about access to quality healthcare, whether it be doctors or fresh food or safe housing. And on this episode of the Tinderbox podcast, I want to talk about a topic that was recently in the news. The World Council of Churches recently hosted a webinar entitled For Every Generation Faith, Justice, and Science in Immunization. And our guest today was a co moderator for this discussion that brought together the World Health Organization experts, faith leaders, and scientific experts working at the intersection of faith and science to explore how vaccines protect people across their lifetime and why equitable access to immunizations are a matter of health justice. So I want to welcome Reverend Dr. Miriam Barnett as our guest and friend of the Tinderbox podcast. And I want to begin by sharing some of Dr. Barnett's distinguished resume. She is currently the president of Resource and Promotion of Health Alliance Incorporated, and she's a convener of the National Council of Churches. She's also with the USA Health Task Force and the co-chair of the World Council of Churches Health and Access Subcommittee in partnership with the World Health Organization. Dr. Barnett also serves as an instructor for the Turner Theological Seminary Certificate in Theology program. And she has worked with U.S. government agencies, including HHS, the CDC, and FEMA. Dr. Barnett is trained in head and heart, and she holds a Doctor of Medicine from Morehouse School of Medicine, a Master's of Public Health, and a Master's of Divinity degrees. Dr. Barnett is a U.S. Army veteran and completed her internal medicine internship and medical residency at Brooke Army Medical Center at Fort Sam in San Antonio, Texas. Welcome to the Tinderbox podcast, Dr. Barnett.
Thank you so very much. It is my pleasure to be with you today.
I want to say I was so excited about the title of the World Council of Churches webinar because there's been so much chatter and a variety of conversations about immunization, vaccines, and vaccine research. And I was even more excited when I saw your name as a co-moderator. And I was like, I immediately thought, I need to get Dr. Barnett on the Tinderbox podcast and push this conversation into our community so we can be more informed and can advocate differently when the conversation comes up about justice in this conversation about vaccine, vaccination, and immunization.
Vaccination is the process by which the vaccine is introduced, whether it be from an injection, whether it be a nasal spray, whether it be by mouth. All three of those are a part of the process that a vaccine can be given. Immunization is your body's alert system that says, I need to produce an antibody. I need to make sure that this pathogen, this germ, this bacteria, virus, fungus, or parasite is actually fought off by my healthy body. So vaccines are the instrument, vaccination is the process how it's introduced, and immunization is your body's now saying, I need to produce fighters against that disease.
And so hearing that, where do you think the confusion that's out in society with regards to how vaccines are administered and what they will do or people perceive that they might do to their body, right? Something bad, right? Where do you think that misconnection is with regards to understanding the terminologies?
And it kind of depends on which community we're talking about. But in the trust and mistrust that is in healthcare is a major portion of that. But then that also comes
Mm.
from economics. I'm the guinea pig.
Yeah.
I'm the one that's being used to try stuff. Um, and we
Yeah.
know our history. We know our
Very
history is
real.
very real, past and
Yes.
present. But if we ask and become our own best advocates, if our faith based communities, our churches, our mosques
Hmm.
help fight for us, it makes a huge difference. For example, if we are talking about
Yeah.
COVID in particular, well, no,
Okay.
let's even back up from there. The fact that we African Americans, those who have lower income levels, are more
Hmm.
subject to disease because of overcrowding, because of already being what's called immunocompromised, our ability to fight something that is being around us, a virus,
Yeah.
the flu, even. The higher rates of flu illness and death are in the lower socioeconomic arenas, or those who are in overcrowded situations. And so getting a vaccine to many people says it's not going to matter anyway. I'm going to be sick anyhow, because that's what they've
Yeah.
experienced in their community.
Yeah.
But we have to counter that
Hmm.
thought. We have to counter that thought, because those who are eligible to get vaccines should get them in order to protect those who
Yeah. And
can't
that
via what's called
herd immunity. Yeah.
herd
Yeah.
immunity.
And
Herd.
what I hear you saying
But
in
if
that also is that hesitancy with regards to vaccination and well, immunization, right? And we saw that we saw a lot of hesitancy in the COVID-19 pandemic.
okay, I'm gonna
Okay.
clear up the language. You said vaccination and you tried to correct yourself to immunization. You
Different.
were right
Okay.
to start
Yep.
with. Right? Vaccination is the process of getting the vaccine. Immunization is what your body then does with it.
Thank you. And I'm glad we have that example again. Language is powerful, right? To understand how language is used, and in particular when we're talking about science and justice in science with regards to our topic today. And that hesitancy, I know from again the just the I'm going to use the word speed. It may not have been really fast for some people with regards to how the COVID-19 vaccine was produced. Depends on who you talk to with regards to that. But that really pushed people into the forefront of this conversation because they never really had that type of um, I'm going to say look into the process before. And so where in that conversation can, and you brought up the religious community, where in that conversation can the religious community really play an integral part of informing our congregants, informing the community where it doesn't feel overwhelming with regards to the language? How might that process take place?
Well, you brought up COVID, so let's
Sure.
use that as an example. The the AME Church, the Church of God in Christ, the many different denominations held webinars. How do I know? I did a lot of them, regardless
Yes.
of denomination. We created a toolkit that allowed people to understand, and we broke it down. And when they still didn't get it, it was every week almost. That we went about 6 months. Every week we were doing a webinar for somebody,
Wow.
so that we could help. Yeah, it
Yeah.
was powerful and exhausting all
I
at the
can I
same
can only
breath.
imagine.
But the point was, we wanted people to understand. We had scientists as a part of the development
Mhm.
group. the development of the webinar group, the information that went out, the handouts, the flyers, the bulletin inserts. We did
Mm.
everything we could in order to keep people as informed as humanly possible. We even did trainings on how
Mm.
vaccines were developed. We had a place and space for infectious disease specialists, for microbiologists and immunologists, for those of us who are practicing, some
Hmm.
clergy and some lay. We taught clergy how to incorporate this information into their
That's
sermons.
awesome. That is awesome. And I hear you saying in that space, it may not have been all of the presenters, but a good portion of the presenters look like us, right?
All of the
Yay!
presenters look like us.
I love that even more. I love that even more because representation matters in the healthcare marketplace and sector. And it ties for me back to what you mentioned earlier about trust of who do you trust to give that information to you, and can you trust someone who looks and presents more that like you do or someone else, because it's so complicated when people are confronted with this information. Like I said, I keep using the word overwhelming. It feels very overwhelming because it's foreign. It's not a conversation that people normally have.
To recognize
Hmm.
who we are in the faith community, who we are in the scientific community, and
Yeah.
whose we are. We all
Oh,
belong to God. And it was powerful to have faith leaders who were scientists who could come to the table
yeah.
and explain. And so to be able to say, my pastor, I was still
Yeah.
pastoring at the time. My pastor was able to stand up in the pulpit and tell me something that didn't sound foreign.
Yeah. Such reassurance, especially in an unprecedented time where people were looking for anchors to ground them and hold them in some sort of safety and security.
And one of the things that happens when people don't trust, they get
Yes.
angry and they completely tune out
Yeah.
and turn off.
Yeah. That's true, and that's so powerful. I mean, this is one of the reasons why this podcast was created, is to bring that trusted information and dialogue to our community. We've got a lot of different things that are happening in the healthcare sector and the marketplace, and it feels or has felt like things are always done to us versus for us, and to address some of the disparities. And so I want to get into a little bit of the research side, because that's where I'm going to call it. I kind of like to nerd out on the research stuff, but everybody may not have that affinity. But what do you see with regards to some of the conversations with regards to vaccines? We've got a potential another thing that we need to keep our eye on with regards to the cruise ships, right? I'm not sure of the exact name of that. You might be um, hantavirus,
Hantavirus. It's the Andes type of hantavirus.
another thing to remember.
Another thing to yet another thing, there are different types of subtypes of disease, and so we, like covid mutated or
Hmm.
adjusted itself how many different
Yeah,
times, and still
yeah,
is,
and
and still is. And so when we say to somebody, oh yeah, but you need to get a second or third or fourth or fifth covid shot,
yes,
right? And we're also misinterpreting the word shot versus vaccine, because maybe they come up with an oral solution, and so we can't use the word shot, but it's the same chemical
right.
makeup.
Words matter. Words matter.
Words matter.
Um, so where do you see the research going with regards to our participation in research because that's always been a challenge, right? Still,
Still is.
still
Yep.
is a challenge. Um, and how do we get past that? How do we get past that barrier? How because I mean, there's a whole host of different things that we know affect us obviously differently because we're not part of the research. But again, when we look at our history, we've been tested on without our permission a whole host of times. And so, how do we get past that barrier where we can trust someone who to do the research to help us because of our physio? I'm going to use the word biology and physiology, potentially. Yeah.
Mm-hmm. Yeah. The thing to recognize is that there are many safeguards in place now that
Hmm.
did not
Okay.
exist
Okay.
in the past. One of the things that I did while we were at the Interdenominational Theological Center was I created an IRB training ground,
Wow. Yeah.
institutional review board, for clergy and lay leaders to come and learn what is the process, what can't they do, what are they supposed to do, how are they supposed to inform somebody that wants to participate, and that the person can decide at the last minute,
Oh,
I don't
that
want to do
is
this.
awesome.
So it was a
Hmm.
3 week process of learning this is what an IRB
Yeah,
is.
because most people have not, if you've not been in any kind of familiarity with research, you would have no idea what that is. And that is one of the safeguards.
And their tech, that's one of the safeguards. And
It's the
it is
safeguard.
the
Yeah.
safeguard.
Yeah.
Yeah. FDA comes behind it, but it starts
Hmm.
at the IRB. If that board, institutional review board, does not approve the
Hmm.
study itself, and there are several steps
Hmm.
in a study,
Yeah.
it doesn't happen. It just doesn't happen. And then there's a central bank, and for all of that information, it is readily accessible. One could go look at it themselves. I've taught lay people,
Hmm.
non-medical people, how to go search for a study.
And what was that experience for them of being introduced to that and introduced to that type of research, right? Of investigation, going out and finding this and then being able to read this information. Knowledge
Knowledge
is
is power.
power. Yeah.
Knowledge is power. And when we can't do it for ourselves, if those who can do it can become the advocates and spokesperson for those who need it, it's a completely different story. The number of stories of physicians and who don't know all of the studies that are available to someone. Let's say they have
Hmm.
cancer of a sort, but if you know how to go to
Hmm.
nih.gov and go look
Yeah.
for yourself, you come back to the physician and say, I want to be, why can't I have this? I
Yeah.
want this, and I want it now.
Right. Because I know it's out there.
I know it's out there. I already looked because on nih.gov it gives you the inclusion and exclusion criteria, who can
Yeah.
participate and who can't, why they can, why they can't. I already know that unless there's something not written that I understood, I'm eligible for this. I want it now. Or you tell me why I
Yeah.
can't have it. And then if they tell you no, go to somebody else and ask them, make sure the
Well, there's
information's the
that.
same.
Right. Advocacy for self. Yeah.
Advocacy for
And
self.
that, go ahead.
Advocacy for self. It's for self
Yeah.
and for others. Our
Mm.
elders in our congregations who may not be able to interpret, or those who have lesser educational experience may not be able to interpret some of the
Yeah.
data that's there. Well, somebody in that, you cannot tell me that at least every congregation has at least one person or somebody's daughter
Yeah.
or son that knows how to read that and can come do a clinic once a week, once a month, and say, on Thursday at 2 o'clock, I'm coming over. And if you want to meet with me, come on and let's go look.
That would, I mean, it's so simple, but it's,
It's
and
very simple.
I think we I think we get in our own way when we, again, we're in, introduced to something that's not familiar to us, and we kind of poo-poo ourselves and say, "Oh, I can't do that," or "That's too hard," or "That's too complicated," or "I can't read that type of information." But again, you're talking about the basis of mutual aid. We're coming together. Who has information, who can share that information, who can decipher the information, and who can give it to others in a way that
Right.
they can understand it at whatever level that they are.
Not related to vaccines, but I remember when Medicare
Hmm.
Part D came out. And the only way you could get signed up was electronically. You had to go onto
Yeah,
somebody's computer and go
yeah.
through the process. We taught YPDers, our Young People's Division, how to do it so that the elderly and who obviously were
Hmm.
Medicare eligible but did not have any
Hmm.
computer skills could sit with them and they could the wife the young person could input the data for them.
Now they're
Now they're
signed
signed
up.
up. And just changed their world altogether because now they weren't trying to figure out how I was going to get medicine versus how was I going to get food.
Right?
The geopolitical, what's another word for that? The atmosphere of politics and economics in this
Yeah.
country in particular, and countries around the world of lower socioeconomic income, are continue to be impacted by
Hmm.
lack of access to healthcare, lack of access
Hmm.
to electronics, lack of access to internet, the list goes on and on and on. And when we go back now to vaccines and immunization, the process of how your body responds to a vaccine so that you can build up, I was going to use the same word again, and I know better than that, immunity, but be able to fight off disease, right? So if I need to my body to fight off disease, it also has to be relatively healthy in order to
That
start.
part.
So if I
Yeah.
don't have food, I don't my diabetes
Yeah.
is not controlled because I'm eating things that are cheaper to eat and I can't afford my medicine. So instead of taking it every day, I'm taking
Yes.
it every other day or every third day or once a week. Um, the air in which I live is contaminated with all kinds of small particles because it's heavily congested and the trucks run through there or other means of
Hmm.
dumping particles,
Hmm.
smog. We've killed the environment. And so now my body is fighting just to stay alive, let alone fight off something foreign,
Right.
a disease.
And then throw in stress and trauma,
Stress and
and
trauma. You're the expert in stress and trauma. It's
it's a
a
nightmare.
nightmare.
Yeah. You're in constant combat mode. And like you said, fighting off everything. And your body never gets the opportunity to rest and rejuvenate
Right.
itself and repair itself.
Right. That's right. You're supposed to, your body will regenerate cells while you are in
Hmm.
what's called REM sleep, the deepest
Hmm.
degree of
Hmm.
sleep. You know that. But if we are working 2 and 3 jobs just to make
Right?
ends meet, where is that
Yeah.
rest coming from?
Yeah. It's not coming from any place. And we're more, like you said, more susceptible because of our social location and all of the different um, factors that are in the communities where we mostly congregate in, let alone all the
Right.
different things that they like to plant and build around those communities, and waste. And we could go
Right.
on with all of the different, like you said, geographical and geopolitical things that that come into play when we're talking about justice and equity, just in this sector
Mm-hmm.
of healthcare and vaccination and vaccines.
Absolutely. When you take our this and the systemic inequalities, the systemic fighting that we have to do in order to just get
Hmm. Hmm.
somewhere,
Hmm.
anywhere,
Hmm.
is continues to be
Yeah.
problematic. Continues to be problematic. And the funding and the shifts in funding and where's the funding coming from in order to get a vaccine produced, because that's also now
Yeah.
where we are.
Yeah. Those barriers are there. And who's going to receive it?
Those correct. Well, we
Yes.
saw that with COVID,
Hmm.
with the COVID vaccines. Who were the first
Hmm.
to get the vaccine? It wasn't us. And even though we wanted to say we were being
Hmm.
made guinea pigs, we weren't the
No.
first to have access.
No, we weren't.
So if you thought you were a guinea pig, what you were was a guinea pig on how long you could stay out there
Yeah.
unprotected.
The conversation again around the awareness of who's funding um, the research or the production of the vaccine and the connections to government. How can, again, from the church perspective, from a religious perspective, that group or the community where the church sits, what are some avenues of getting more informed in that, of how to have our voices heard with regards to that particular kind of conversation, and to I mean, I know everyone's like, yeah, write your representative. A lot of times there's other things that we can do other than write our representative. So what are some of those other things that we can do to bring awareness of our concern and our desire to have information about that aspect of this conversation about funding of vaccines and vaccination?
One of the things that people
Hmm.
don't think about because we're not in
Hmm.
that arena all the time is the IRBs. The IRBs have to have a community person
Yes.
slot. But do we go, and this is one of the reasons I created that
Hmm.
training ground. When we go, do we know what we're looking for?
I'm going to say no.
Do we know what our voice, right? And do we know what our, can we learn what our voice is supposed to bring to that table? Or are we just taking
Yeah.
up a slot?
Yeah.
So we need to become informed enough. And the IRB training is online and it's
Wow.
free.
Say that again for the people in the back of the house.
The, the IRB training is online and it is free. Then you take yourself up, pick yourself up off your couch where you're not doing anything, you're not engaged. You go to church on Sunday morning or Wednesday night for Bible study, and then nothing
Hmm.
else happens after that. You take yourself down to the hospital or wherever the IRB is located in your community, and you say, I want that slot.
Huh. That's it.
Give me that slot.
Yeah.
You're trained. You've got a certificate. You print off the certificate. You go down and you say, I want the slot. I'm eligible for this slot. Give it to me now.
Awesome.
I do a lot of give
I
it to
see
me
that.
nows.
I love that aspect of your personality. It's endearing.
The other thing, to you, not to most.
That's okay. They'll catch on.
But we have to be able to, the information is out there, we just don't access it. So one of the things I liked about when you came to me and asked the question is, I want to be able to
Yeah.
give resources. So I'm going to send you a list of
Yes.
resources that can be posted with your podcast that says go
Oh,
do
that
this.
is fantastic. Thank you so much for that.
We can't do what we
Yeah.
don't know to
And
do.
someone's got the information. We
And
just
that's
haven't
why,
tapped into who has the information.
exactly. And we must do it in each and every one of our
Yeah.
communities where there is a research center.
Yeah.
It's a
Yeah.
must.
Yeah.
It's a must. We also, for those that don't want to listen to science all day, those people who are involved in the politics or the civics,
Hmm.
because it's more than
Hmm.
politics, it's civics, need to make sure they're doing that. Are you sitting on the school board or are you going to the school board meetings in order to make sure your child can become educated so that they are eligible to become a scientist or become someone who's going to
Yeah.
shape economics? Or are we allowing our children to be
Yeah.
undereducated? So pick an area that is sensitive, that you have a sense of
Hmm. Hmm.
belonging to, and find out how you can be engaged in the political and civic and social
Hmm.
movement that engages your community. And your congregation is not made up of just the people in those
That's
four
right.
walls. It is the people outside your four walls. It is, if you are a United Methodist, are you working with the Jewish community down the street? Are you working with
Hmm.
the Islamic
Hmm.
community down the street? How about the AME, the Baptist, and the Kojic? You know, in some of our communities, you can throw a rock and you hit five different
Absolutely.
houses of worship.
Absolutely.
Are we
Yeah.
working together?
And and that we have, again, in our own in our own communities, we've become so stratified. We've become so disconnected from each other, and we can't, as you said, we can't risk not being in community with each other and building our forces together, because we're all in this together. It's not about our faith belief. It's about survival. It's about wellness and well-being, right? It's about living well, and living healthy.
It's
Yeah.
about, yeah. John Chazelle wrote a book. He was a dentist, but a very spiritual person. Wrote a book
Hmm.
on optimal health, and he contends that we cannot survive in this world without every aspect of our life being
Yeah.
intact.
And we've got fragmented pieces of our lived existence, and things
That's
keep,
right. And to try to separate, yeah, and trying to separate our spiritual life
well,
from our secular life only makes us have
yeah,
dis-ease. Because that's not, it's in the African American community, in the Native American communities, in all of the First Nation communities. You can't separate us. When you fragment us, we
yeah,
become ill.
yeah. There's lots of illness and, like I said, disease, that springs up and really affects us differently. And that grounding, whether it be religion, spirituality, um, you know, being in tune with nature, whatever it is, that connectiveness to some higher power, some higher being, that is central to all of us. And
That's
that
right.
has to be fed, that has to be protected in order for us to be, the best selves, that we can be.
Right.
um, I'm trying to think of, I think the question that I want to ask you is, um, what in your span of your career, some what is a moment, or maybe two, that you were really excited about, where um, research, or where um, advocacy was going, and then what caused a turn for you to feel differently about where some of healthcare is going, with, I'm going to just use the word, disparities, right? That yin and that yang.
Yeah. I thought we were doing much better in terms of what we could self advocate for in the
Yeah.
healthcare system. And then my father
Mm.
became ill. And I realized very quickly that I needed to stay in the hospital with him when he was in the hospital.
Yeah. Hmm.
that I was his mouthpiece.
Yeah.
And even though they knew I was a physician,
Yes. Right.
it was problematic
Hmm.
until you found the right person,
Yeah.
and that
Yeah.
unlocked the doors. So it's still a problem, but there are people out there. You just have to
Yeah.
find them who will help to
Yeah.
advocate or hear you and see you. The question is, have you pushed
Hmm.
enough buttons? Have you said enough times, I want it now?
That's going to be your tagline. I want it now.
That's the tagline. I want it now. Have you said
Yeah.
it enough times that they hear you and they see you and know you're
Yeah.
not going anywhere?
Yeah. Absolutely. To not be afraid of, like you said, advocating for yourself and the person that you love. Um, that conversation and that time spent in conversation is do you, not to be dismissed, not to be on someone's
Hmm.
timetable, but to answer questions. Um, yeah.
That's right. Exactly. And demand an answer. And many of us in healthcare, I'm sure you've had the same experience. When your family member goes to the physician, you're on
Yes.
speakerphone.
Yep.
That's the kind of advocacy that we need to be able to say, I
Hmm.
can't go today, but cousin so and so or um, Mama Jones, who sits on the third pew in the center section, she's free. They just need to know that
Yeah.
somebody is there
Yeah.
taking notes.
Yeah.
You don't have to
Hmm.
understand what's happening. It's a body in the room that's
Hmm.
taking notes, misspelled
Right.
or not,
Right.
doesn't matter. We can figure it out later when you get
Yeah.
back, but come back with the
Yeah.
information so we can
Well,
assist. Those of us that know can
and so that you
assist.
have someone else who's listening as well, because if you're the patient, if you're the person being examined, if you're and you're trying to hear, you can't hear and take notes at the same time. It's a struggle. Yeah.
Correct.
And to have a scribe.
And right. And if the information is not what you
Yeah.
wanted to hear, are you
That
still
part.
listening?
Yeah. Have you tuned out? Hmm.
Have you tuned out? I don't want to hear what you have to say. I'm no
Yeah.
longer listening. And so you get back home and somebody
I
says, well,
don't
what
know.
did they say? I don't know.
Yes. I have no idea what they said.
I don't know. I have no idea. Take that back to vaccines. We're supposed to get vaccines on a periodic
Yeah.
basis throughout our lives. Do you know the
Right.
schedule? Are you in this geopolitical arena? Are we listening to the right person telling us what the
Well,
schedule
yeah.
is?
Have some interesting
Yeah,
voices out there in the ether.
there are some interesting voices, but do you at least know the schedule that was out
Yeah.
before they got there?
Right. Yeah.
Right. So that
That
schedule is a
schedule is
good
a good
schedule.
schedule.
You 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 need to find the schedule from 2 years ago
That's the
because that's
schedule.
the schedule.
Yeah.
It hasn't
Yeah.
changed.
It has not. Um, I want to close by asking you, what are some things that you that are bubbling up in your spirit on the horizon of kind of thinking about all the different things that are happening right now? What are some things that you think our community should be paying attention to with regards to, yes, our conversation with vaccines and vaccination, and other things that are connected to that that we need to really pay attention to coming up?
We need to pay attention to the schedule and when they shift the schedule.
Okay.
Why did they schedule shift
Hmm.
the vaccine schedule? Did it make? Is it
Hmm.
based in science or is it just because I felt like doing it? The other piece, and that means relying on those of us
Sure.
who know, identifying who
Okay.
those persons are. The second major piece for me is the economics of
Mm-hmm.
healthcare insurance. Are we paying attention? Are we maximizing what we're eligible for? Can we find another way that's even better for when the open enrollment comes? Are you actually looking at your options, or are you just signing off or doing nothing, which means you
Sure.
automatically roll over? But there may
Yeah.
have been a better option.
Yeah.
Did you look? I mean, how many people tell me I have Medicare and so I don't need to look anymore? Well, they change the Medicare options
Every
every
year.
year. Every year it changes. And so are you getting the best bang
Mm-hmm.
for your buck? Right? And in addition to that, for those who are not Medicare eligible or who are in the workforce, have you maximized your educational opportunities so that you can maximize your income?
Say more.
Or well, healthcare is driven by
Yeah.
economics and income. Right? Do you have enough food? Have you taken the land that's in the back of your yard and turned it into a garden? Have you taken what do you call it?
Planters. Yeah.
Planters and, and are growing vegetables inside your home if you don't have a backyard? Who says you have to have a
Yeah.
backyard to have a garden? You got a window? Okay. Stick a plant in it.
Right.
So that you can have food when the grocery store says I don't
Yeah.
have any more. Or you need food that is actually healthy for you and you stop eating the high carb, high fat because it's cheaper. At least get some vegetables, some lettuce. Lettuce is easy
Lettuces.
to
Yeah.
grow. Tomatoes are
Sure.
relatively easy to grow. You get all of the vitamins you need in your house and then go get the other things that are going to supplement. And who said you had to have meat every day?
Yeah. You don't. Mm-mm.
You don't. You don't. So between knowing about the healthcare insurance system, knowing what is myth
Mm-hmm.
versus fact, knowing what we can do
Mm-hmm.
together, and how all of the pieces of our life impact
Yeah.
our health, from policies to interventions to our
Yeah.
behavior. That's how we get the maximum out of even a vaccine. Because remember, it's vaccine plus
Mm-hmm.
vaccination equals
Mm-hmm.
immunization. No good body, no healthy body, no body that can respond to the vaccine and the vaccination means you're still not going to be the best you can be.
Dr. Barnett, you are amazing. Um, I could
Bless you.
I could talk to you for so many hours about all the different things that and the expertise that you bring to this sector of work. I know it is a love of yours between being a physician and also having taken CPE and chaplaincy and advocacy for the marginalized communities, especially our black and brown folks, and all of the work that you have done to be a voice and a beacon out into the community and to share that freely with us. I thank you for that work. I thank you for your ministry. I thank you for your love and your compassion for community and wellness and well-being. And I thank you for being a friend of the Tinderbox podcast. Is there any closings to our audience?
Be your own best
I
advocate.
love it. Be your own best advocate. On that, we will close out our segment of the podcast. And I'm going to post when Dr. Barnett gives the resources that she is going to share with us. I will post that with the community. And let's see what we can do with, again, bringing voices together that don't normally have conversation together. See if we can be advocates for educating our community of ways that they can engage differently, for being an advocate for themselves and living a life of wellness and well being. Until next time, uh, continue to be kindled, and be the spark of conversation, and you will fit right in with Tinderbox podcast. Blessings.
Listen.